Welcome to the Hood Talks Podcast, live and in person. Woo! Shout out to everybody for being here. Please, please, please come to the center. We are about to get this show on the road. Shout out to everybody that's tuning in from social media. Shout out to the social media world. Shout out to IHN, to our partners, St. Louis Integrated Health Network, and said and pull up and was like, hey, we need to do this event. I agreed. Yes. Why wouldn't I? But yeah, so shout out to everybody that is here in the space. Just want to give a shout out to all of the vendors here. We got People's Health Center in the building. Shout out to them. We got Family Health Care Center in the building. Shout out to them. We got Athenia in the building. Shout out to Athenia. They're also doing Medicaid enrollment. So shout out to them. And we got IHN in the building. And Care STL is in the building. Okay, we got a lot going on. We got a lot going on. Okay, y'all. So definitely join us. I am missing something, but y'all know that's me. I'm a co-host. Shantae Love is in the building. Can you find my, I think it's in the office. All right, y'all. Hi, panel. If y'all don't know me, my name is Vanna. I am the host and creator of the Hood Talks podcast. We have been doing this podcast since 2020. Woo, can y'all believe it? And here it is, almost it's 2024, and December would be our 4th year, and hopefully next year will be our 5th season. Woo, yes. Okay, yes. And we started doing events. Shout out to our first official, my family, the Generate Health fam. They came along and partnered with us this year to do events in person. And I always was like, we need some lit community events. No shade, but I'm about to shade. And we keep it real and raw at the Hood Talks podcast, okay? Okay, always. I was like, these events are a little dry, Everybody just scrambling, it's like a assembly line trying to get the resources and making everybody go to people's tables. I was just like, this is a lot. And I was like, why can't events be fun? Why can't they be upscale? Okay, why can't we have a vibe? And so the Hood Talks was really like, we want to really do that for our community. And so we started doing community events and setting a vibe. And so shout out to Work and Leisure, because they definitely have a vibe in this space. Yes, it is giving a lot. And so what other events do you come where you get free drinks, a vibe? Shout out to DJ Sweetie on the ones and twos. Yes, setting the vibe. So we're going to get into the conversation, because that's exactly what we're here for as well. But I just wanted to just set that stage to let people know that this is really, really what we want to continue doing here at the Hood Talks podcast. So, and thank you all for coming and joining us, and shout out to everybody that's watching. Now to my panel. Y'all ready for me? Okay. Well, thank you guys for joining me. This is going to be a great conversation. I'm so excited to talk to you all, because there's so much I didn't know, still don't know about just the safety net. Shout out to Jesse. When he approached me, he was like, yeah, we want to talk about the safety net. And I'm just like, bro, what is that? What is the safety net? And I'm like, well, Shavannah, if you don't know, I'm sure there's a lot of people that don't know as well. So this is something that we need to talk about, right? It's because I tell people, baby, let me tell you, I don't know everything, okay? Don't call it, I don't know everything, but this is why we're here, to learn. So I'm going to let you all introduce yourselves, tell people who you are, who you represent, what do you do, and we're going to start here. Yes. Can y'all hear me? No. It's green.
I just am a low talker anyway. So I'm Dr. Aramide Ayarinde, CEO of Family Care Health Centers. We have 4 locations in St. Louis. We are in Places for People, Run for Women, off of Manchester in Forest Park, and in the Carondelet area. Fun fact about me, I love football. Go Eagles. All right, good evening, y'all. Melissa Tapey. I am an OBGYN.
I am the Chief Medical Officer at Affinia Healthcare in the city. I have been there 15 years. I grew up in a little farm town in southern Illinois. This was always the big city to me, so thank you for inviting me. And I really just love what we do. Affinia has most of our locations kind of east of Grand in the city. And then we also have a location in Ferguson and one in Pagedale.
A fun fact.
Oh. Fun fact. Oh, hi, Laura. How are you? I just saw you sit down. Fun fact. Well, I was talking about how you like to dance, right? I used to tap dance. After. We're going to need the music back on, and I'm going to need a drink. But then you're on. Come on.
I got to get my microphone voice ready. How's everybody doing?
Black Planet. Look nice.
Hey, I appreciate that. Hi, I'm Dr. Ronald Griffin. I am the Chief Operating Officer for People's Health Center, Betty Jean Kerr People's Health Center, also for the Amanda Luckett Murphy Hopewell Center, as well as our People Action Corporation called PCAC. So we have locations all over the metropolitan area, to include in North County. We have our Ferguson and our West Florissant location. Our range is so broad and massive, just like all of the other FQHCs on the stage, and we are your safety net. Fun fact, Melissa stole it. Yeah. Hey, look, at home, I'm hitting every dance move out there, trying to. And so it's just a pleasure to be here, and thank you for hosting this event. I'm sorry, one more thing. I'm a doctor of nursing practice, not an MD.
We're on now. Testing 1, 2, 3. All right, so those are hard acts to follow. I'm Dr. Michael Spearman. I'm a practicing internist with Care STL Health as the acting director of medical services. And so we're also a federally qualified health center, acting as a safety net and source of primary care for all the greater St. Louis area. We have 4 offices in the North City, North County area, in addition to school-based health. And we try to provide health care for everyone, along with everyone else that does that here. So thank you for having us today. Fun fact, I'm not that much fun. I guess I would say that I'd like to shout out my wife is the smart one in the family. She's an entrepreneur, LPN, excellent cook. She has a long list of talents to my one.
Why aren't you about with the one? I mean,
I'm about to say, he might not be a fun man, but he a smart one, okay? He called that wife out. He said, my wife, that is a smart man, all right? Yes, all right. So we is going to get into this conversation, y'all, okay? I just want to let you know it's a dog-eat-dog world out here in Knoxville. So when I ask a question, I will let you all feel free to tap in. Just be respectful of each other, okay? So my first question, you kind of answered it a little bit. You said that we're the safety net. But what is, when we talk about saying the safety net, especially here in St. Louis, what does that truly mean? What is that?
So for health centers, we are the backbone, I would say the backbone of the health systems, where individuals who are underserved or unrepresented or cannot afford healthcare services can come to us. So we ensure that whether you can afford care or not, that we're available to provide care to you. And that's inclusive of medical, dental, and behavioral health services for all of us.
yeah, what she said. And in a nutshell, go ahead, Melissa. I'm sorry.
Oh, no, that's all right. I do think we are the backbone of the safety net, especially when it comes to primary care, medical, dental, behavioral health, like you were speaking of. We also have our health departments, right, which are also good resources. And then in the city, we don't have a public hospital. So for most of our city residents, right, they're going to go to our academic centers for hospital care. And we really want them to come to primary care, which is really where all of us step in, because we're not going to turn anyone away based on their ability to pay or what type of insurance they might have or if they have Medicaid. And that is why we exist, and that's why we're here.
Something, academic care. So can you explain deeper to what that means? So you said there's not hospitals in the St. Louis City area that is.
So St. Louis doesn't have a public hospital, right? Like a St. Louis City Hospital or a St. Louis County Hospital. We used to, but we do not any longer. And so St. Louis University Hospital, right, which is merged with SSM, Barnes, which is with WashU, they're really your safety net hospitals in St. Louis City. There's other hospitals in the county as well, but they have to function as a safety net because we don't have a public hospital system.
And that is important because what that means is a lot of these hospitals are ran by those entities, right? They're institutions, not necessarily, like you said, the government is funding them necessarily, right?
Yeah. They do get some government funding, like to care for patients, but right, they are their own institutions. And they do have to step up and take care and be part of the safety net. But it is a different dynamic. And I think it's a different dynamic for the community too, who may once have been used to a community hospital or have seen their community hospital close, right? And then have had to transition to getting care at a private or academic institution.
So let's get down to this. Here it is. You have your health system organizations like your BJCs, your SSMs, and you see how big and how busy it is to navigate through that system. With us, you got a one-stop shop where you can get all of your services, and because we have good referral relationships with these HSOs, health system organizations, that allows us to get some specialty care. Can they do more? Absolutely they can. And because of organizations like IHN bringing us all to the table so that we can have these impactful conversations about health equity and who has the role to do what.
That's all. So yes, my colleagues have put it very well. And looking at the safety net type of issue, the idea is that it is best to get your health care from the start, not to wait until the crisis occurs. Some damage may already be done. It may be difficult to treat, may not be reversible, and you're having to deal with it. We're talking about primary care. That is, start from the time you pop out from the womb until the other end of the spectrum, trying to see that each person is healthy, trying to prevent health issues as best we can, trying to deal with them as they come, helping those that have popped out grow to the point that they can help take care of themselves and not have to spend an arm and a leg. As you well know, there's a long wait to get through an emergency room, and again, they are for emergencies. They deal with the spot situations, and they're not designed to do comprehensive health care. Actually used to be our name, comprehensive health. But yeah, we all provide comprehensive health care with the emphasis. The bottom of the platform is to do primary and preventative care. Then comes the secondary for when we can't, and of course the tertiary when there are significant illnesses but the basis is how can we be healthy and keep it that way as long as possible, get good outcomes, and have long, productive, worthwhile lives from a healthcare standpoint. And it's psychosocial as well as medical.
So it sounds like what the space is here for is under-resourced, who may not be insured, to come and get preventive, primary, which means on a regular base care. Because I know a lot of times, sometimes when you don't have insurance, you're quick to just go into the emergency room for maybe a cold, maybe, you got something on your arm that you don't know what it is. But if you come and you say, like, I don't have insurance, but I want a primary care who can see me maybe to manage my diabetes, my sugars, or manage my blood pressure, I can come into this space, Affinia, a family health care center, a Care STL, a People's, all of them, either one of them, and access care and get connected to a primary care doctor who can support me throughout my journey, even if I have insurance too, right?
Yeah.
I go to Affinia.
She said she goes to Affinia. Okay. Shout out to Affinia in Ferguson. I love the midwifery there.
Well, the care, I really believe that all of us provide very high quality care, right? So if I truly believe that and I work there, why wouldn't I get care there myself, right? So it's my kids go there, I go there, my husband's gone there. We all utilize the services. They are very high quality. I can get them all there. My kids can go to the pediatrician, we can go to the dentist. Yes, you can have private insurance, you can have Medicaid, or you can have no insurance whatsoever. And there's a sliding fee for that. There's also services then, as you see the tables today, like our staff members will help you sign up for Medicaid or see if you qualify for an Affordable Care Act plan, right? Because we would like everyone, just as most people would like, to have some type of coverage, right? It does make it easier, not only for the visit, but for medicines. Those are crazy expensive, right? Like to have your monthly diabetic meds or your hypertensive meds, those are not cheap. And so to have the additional social supports to help people kind of navigate the healthcare system, which is complex beyond belief, is super helpful.
Yes, and if I may, so when we talked about Medicaid expansion and we talk about enrollment, so all of us have community health workers in these spots helping you to get the care that you need through the insurance portals, right? Here's the rub. While you're pending, we still see you. We don't turn you away. You go through and get it done. You can go to WIC services. You can go to women's health. You can go to pediatrics, internal medicine. We all have pharmacies. Why go to Walgreens? You don't have to. We all have dental.
And can I clarify? So if I come and I don't have Medicaid, I don't have insurance, I don't have Medicaid, I have not got anything done, but I just need support. I need help with my blood pressure because it's high, I'm having headaches, and I come in and I say, can you care for me?
Yes.
Will I get a bill?
So we have a sliding fee scale, number one, and then we write off stuff too, right? Because we're covered through a 330 grant through HRSA, and I don't really want to get into the dynamics of that piece, but what we do is we provide care. That's our mission. All of us have similar missions, and the bottom line is that we care about community engagement and health equity. And for people who don't take advantage of these opportunities, it's really a slap in the face to us as a community to know that we have these services, but you rather go to the ER or Barnes or SSM thinking you're getting better care when they all come to us too. They work in our departments.
I must say, baby, shout out to BJC, SSM, and them, but they got some work to do, Lord. We keep it real and raw on the Hood Talks podcast, and BJC has sponsored us, but we just like to keep it real and raw. We know that they got some work to do.
And if I could add that as part of federally qualified health centers, we're required to have 50% of our board be patients of the health center. And so not many institutions have patients sit on the board to validate, I'll just use validate, but to really say that I entrust in the staff enough that I will receive care where I am a board member.
Did y'all hear that? So I need y'all to go apply and be on the board if you feel like you need to put some input in. Okay, we need some board members, Mr. Carey. I got you. No, I got you. Okay. Yes. So talk more, because that was new to me. I didn't know that. Talk more about what that people really need to understand, because I think there's a lot of myths about the federally qualified healthcare centers in St. Louis. What is one that we need to address? I'm gonna let each of y'all answer this question. What is something that you think needs to be addressed that people need to know about?
That we don't provide the same level of care as some of our other institutions. I think on this seat alone, many of us are awardees of many different recognition boards. We have Patient-Centered Medical Home Recognition, which is a national organization that gives us our seal or stamp of seal or seal of stamp, whatever that saying is tonight, that we do great, excellent care. We are highly regulated by many agencies that come and say, show us your standards, show us your processes. So we rival, and if we could say here, are better than some of our other larger institutions.
It's what it is. We're saying facts. In this space, for the community, we are community-based. These are the services that we're providing so that we can prevent those emergency room visits, those urgent care visits. You get that with all of the folks here on stage and the ones that aren't.
I would agree. I think we do provide very high quality care, right? We have the same certificates. We have similar regulations that the hospitals would have. I think another thing too, as a physician, is that sometimes folks think, well, I'm just here because I couldn't get another job, or I'm paying off my loans, right? Because there's what they call loan forgiveness, right? Or some scholarships sometimes for going to work at places like community health centers. And I would also say, while, where you go to school is not everything, but if you also look at the websites or the resumes of the doctors and the staff at community health centers, they are top-notch, right? Those folks are there because they want to be there, not because they had to be there. And I would never want one of my patients to think I am there because somehow this was the last resort. That's awful, right? This is my choice. This is where I choose to work. This is where I want to work, right? And so I think that's also important to know.
All right. But so resources, again, was mentioned. And all four of our organizations are very dedicated to providing health care. And yes, healthcare indeed, that's more than just taking a pill. It's more than just taking your blood pressure. We're talking about trying to prevent diabetes in the first place, trying to detect elevated blood pressures before it happens, trying to catch that cholesterol level before it builds up and starts to clog in your arteries, and resources. One thinks of going to the doctor. You've got a cold, you got a fever, your back went out. You go to the doctor and you get that worked on. And all four of these groups here, you can go to that our doctor's office and try to find some ground level help. We have at CareSTL Health, we have a mobile grocery store that comes to the North City area to provide high quality foods, groceries at low price, so that people can afford to get some decent food and not have to worry about skimping, eating junk food that's going to clog their arteries, raise their pressure, raise their weight, and get in the way. Housing, economic resources. You can, if you are stressed, you can go. You not only can you go to the doctor, you can talk to a counselor in the same building, probably the same day. You don't have to get an appointment 10 weeks away and 20 miles away. We have the psychiatry services, basic women's health in all of our services. We can help deliver the babies, help them, like I said, help them to grow up.
Yep.
We've had multiple generations come through our center. I'm sure it's the same for all of you. And we've got grandparents, parents bringing their children to our centers to get their health care and perpetuate their families. So it's resources. And I'm sure all of our leaders, I know our CEO is out in the community trying to see about helping the community, trying to decrease the violence, trying to increase the awareness, increase the resources. Thank you. There we go. And we had an opiate awareness walk with CareSTL Health. I'm sure all of these groups up here have similar activities. So it's not just about prescribing pills. It's about the well-being of the community.
And total care, right? So that's what you're saying, right? You're looking at taking the human dynamic and addressing every aspect of it. So if you're obese, all of us have nutritionists. We have dietitians. You can see them. You can walk in. Most of us have walk-in slots that first time ever coming, you register through and you get seen by a provider. Who does that? You can't. I'm not trying to put anybody on blast. I'm just saying you can't do that in the big health systems. You can't do it.
You can't. You're right.
And then here's the other part. Even when we're booked, we'll double book. Can I get real with you for a second? I'm sorry.
We keep it rolling, Ron. This is the Hood Talks podcast, sir.
My daughter told me don't get carried away, but I have to say this.
Please
do. One of my pet peeves with all of the services that we provide is our no-show rate. So we provide services for the community, and we take everything that we can to make sure that you get an appointment and you don't show up. That's problematic because our funding is based on the encounters that we get. And if you don't come, we're not going to be funded to provide these services. That's real.
Can I push back? I wouldn't be me if I didn't.
Please do.
Come on now.
Let's go.
Because maybe you say, I am a mom. Because I am a mom. All right. And I have two little ones who, for some reason, I just can't get them to the appointment. And I don't have a sitter because we know during the pandemic, that was a big thing about, hey, you can't bring your kids. So what can I do?
Says who?
That was what said to me, but that probably wasn't Affinia or you all. I ain't gonna say who it was. And it would have changed since COVID, but just to say that there's some barriers that I'm dealing with, right? Maybe it's transportation. Maybe I'm on the bus, trying to get on the bus with a toddler, 2 or 3, or maybe even if I tried to get, don't get me wrong, because I've tried to call transportation, and we know there's transportation services that don't accurately come. So yes, I hear you that no shows sometimes we don't show up, but sometimes there are barriers. So how do you guys are addressing those barriers?
Just let us know. Just tell us. We have extended hours. All of us have extended hours, right? We have social service that can help. We can give a cab voucher, or we're all of us are trying to get some collaborations because we're open to community participation in this space. So what we're working on right now is getting contracts with Uber and Lyft to provide these services. That's next level. That's innovative. And we all are having these conversations because really there's no competition on this stage. You're going to go to CareSTL, or you're going to go to Family Care. You're going to come to People's because that's what we do as a community. We go around and see where we can get in, and we support that. We're okay with that. We just want to make sure that we remove the barriers. That's our job. Remove the barriers to care and allow you to be able to come in and get some care that covers your whole person. I'm sorry, I don't mean to take up so much time.
And it is hard to get in, right? Work,
well said.
Kids, transportation, all the things. I completely agree. The more we know, the better, right? Like if you text and say you're running late, if you call, we can help with transportation, right? We all have community health workers as well to help with those things. We all have telehealth offerings now. So we will do our very best to work with you. We understand life can, yes, be chaotic and all kinds of things can come up. Sometimes they're known about, sometimes they're not. But we would love to hear from people just to know, right? Because maybe someone else is calling in and saying, hey, I need a same day appointment. And if I knew someone else wasn't coming in, I'd slide them right on in and then get the other person moved to when they could come in. It's that communication piece that's would be the most helpful. And on either side, because I'm sure we're not perfect at it either, right?
Yeah, thank you all for that. And I think that clarifies for what I was trying to get at. Right. That there is support that you all offer for those things, right? There is maybe, like you said, I love that, cab vouchers, right? So if you're having transportation issues, community health workers, shout out to my community health workers. Yes, shout out to them. You can get access, social workers. Is that a thing there too, right?
Facts. We have that too.
Okay. Mental. So it's a one-stop shop, right? Mental health, behavioral health services, prenatal care services. So even your children, dental services, men's care.
Adult, children, adolescent, dental, across the board. Medicare, Medicaid, commercial insurance.
And you can get your medication on the spot.
No insurance, underinsured.
No insurance, underinsured.
And most of our pharmacies do home delivery. So even if you don't want to wait, we could get your meds delivered to you.
Baby, shout out to delivery, baby, because who be like to go, baby, if you got babies like I got babies, baby, I'll be like, can y'all deliver everything to me? Because I ain't trying to drag these kids outside. So y'all just making it easy. I think why we don't tap in is because we don't know. I'm always saying it. That's why we got the Talks podcast. It's because we don't know. A lot of times we don't know what's offering in our communities, right? And then when we do know, let's be real. Black and brown communities are usually sometimes treated differently, and we keep it real and raw on here in the Hood Talks podcast. And we know we talk about health equity, access, but we also talk about the bias and racism that is in our healthcare system. How are you guys counteracting that where you are?
So at Family Care Health Centers, we have a Justice, Equity, Diversity, and Inclusion Council in which we look at patient care from that lens and look to address any of those barriers that may prevent Black and brown communities from coming into the health center.
Hear, hear. Also, I would say the board members, right? Super important. The board members that she mentioned that have to be patients, right? Need to represent the community. Those are Black and brown people who get to sit on the board and help make all of our top level decisions. I would also say workforce pathways, right? You will see, I'm sure, many of us in different settings working at the elementary school level or middle school level and then to high school and then working on those pathways, right? Back into our health centers so that community members can be part of the team, right? With that, over time, hopefully more and more people will know, more and more people will trust. The health center will more and more look like the people that use the health center. In South City, we see quite a few refugees, right? And so again, it's not that our entire staff is overnight going to look like each refugee population that we care for. But over time, that does happen, right? And that does mean a lot. I mean, take it from me. I do not look like every patient I take care of, right? I completely realize that. I realize that I also really, really hope and want to form a bond that is full of trust, right? And I want to build rapport with my patients. We will always have folks that maybe don't look like us in the health center or don't have a shared experience. But we really do want to build those pathways so that most of us do, and that there is a shared experience and a trust that can be built. Because healthcare can be challenging, and we know it historically. It has not been full of trust, and it has not been a healing bond between healthcare and the Black and brown community.
Yeah, that's well said, Melissa. You're spot on that. And something else, we hire the community. Yeah, we have job openings right now. All of us.
Okay.
So everybody that's listening on this podcast, go to our respective websites, apply for the job. chances are we will most definitely bring you in for an interview, and the rest is up to you. And then she talked about the marginalized people that come from other countries and such. We all have interpreter services. People's Health Center, we have interpreter services. So we want to make sure that we're able to communicate effectively with you to make sure that you get. Did somebody telling me something? Okay. That you get the care that you're supposed to have. He's like, pass the mic.
Nice to be with you guys. This is what we're here for. We have trainings to remind us. Yes, I did have to go through medical school to get here, but we have trainings, grassroots reminders to keep us centered on people and not just being the doctor trying to tell people what to do. We have the basic premise, patient-centered healthcare. So the healthcare is not centered around the doctor or even the health center. The healthcare is centered around the patient. You've got the whole group, the nurse, the doctor, the registration clerk, the social worker, the counselor, the chiropractor, the dentist. We're all circled around the patient to make sure the patient gets what they need. The patient interacts to help us get the patient what they need. So it's, this is science and art too. That means that it's not carved in stone, precise, that everybody fits in the same cookie sheet. And so there are different ways that may apply to different situations. We have the patients involved in helping us to make these decisions and informing patients, educating patients so that they can better help take care of themselves.
I think also we're all required to do trainings as part of our regulatory bodies. So again, we're heavily regulated. And part of that is ensuring that the training is beyond our initial, for the doctors, for instance, beyond their medical school training. So we all go through culturally competency training, make sure that we are embracing varying cultures and people as part of that. And so the litany of trainings that we go through beyond our initial diplomas is extensive.
One other training I think that's important and that continues is bias training, right? Your internal bias. We all have different biases to keep us alive, to help us make quick decisions. And sometimes those are good skills to have, and sometimes they're very harmful skills that we've developed over time. And so that training, I don't think ever goes away, right? And so whether it's about race or ethnicity or body type or rural versus urban, or it could be a whole litany of things, right? I'm a tap dancer and maybe you like hip hop. I don't know. But whatever my bias might be against that, right? Those are things that you have to learn about. You have to check. You have to reflect on. And then you have to see the person in front of you. And those are learnings that never stop, right? And so they are ongoing all the time.
And these biases aren't steeped in racial identity. A lot of it's cultural too. So when we start talking about biases, it's not just white on black or black on yellow or anything like that. It's really the cultural basis and the things that we believe in and where we come from. So they have a lot of impact on how we treat other people.
The things that we are taught. White supremacy culture ain't just for white folks.
It's not.
Oh, let me
Oh, you can say that. This the Hood podcast. Right?
What you said,
okay.
You better. But I agree. We've learned, we've learned that in our systems, a lot of times too, folks could look like us and we can perpetrate some of the same things that we've been taught, right? The medical system, the systems that we tend to work. Oh, I see you. Come on, sir. Hey. The things that we tend to work in, we begin to learn the things that we should not learn. It's really about unlearning. It's rooted in a lot of our things, right? So, of course, why wouldn't it be rooted in our healthcare system? And so when you go into working into these systems, sometimes, unfortunately, you become the system, no matter your race.
And before you ask, let me just say this. I'm not saying that we're perfect, because we aren't, right? Because when you come in, I want you to be treated with respect and dignity, customer service first. You know, I hate when I get feedback from patients that come in and say that they were treated illy. That's a problem for all of us. That's not something we appreciate, nor something that we condone. So just know that everybody up here is a leader in their own right. And we will not tolerate that. We owe that to you. Come in and feel comfortable in the space. Then we're going to take every complaint, every issue or concern that you have very seriously. It won't work for me.
There we go.
So,
We needed the people on the line to hear that. You done took away the mic.
they couldn't hear it?
No, you done took away the mic.
My fault.
It's good. We appreciate that. So, okay, y'all. Now, I don't like to just ask questions. That ain't what the Hood Talks podcast is all about, especially when we get in person. I like to have and give space to the audience to ask questions, okay? So I'm going to come to you all. I got you already noted. Mr. Carey, I'm coming to you first. Yeah, you remember you said you had a question. And then I got you, Melissa. So anybody that has a question, just let me know. I'm coming to you with my mic. Mr. Carey. Hey, sir.
Mr. Carey.
Hey, how y'all doing? Y'all doing an excellent job tonight. So, y'all had touched base on culture, right? So when I think about culture, I think about the young Black and brown under-recognized, those who, I know when I was young, I didn't think about going to the doctor. Matter of fact, if I went to the hospital, it was because something serious had happened, right? Between the ages of maybe 18 to 25, right? That age demographic, especially for Black and brown, underprivileged, don't typically think about their health and the concerns that may come along with it, and let alone have any idea about the institutions that you all represent, right? So how do you, and then not to mention the mental health that goes along with that, and the underprivileged neighborhoods or whatever. So how do you go about exposing the services that you all have available to those who are severely in need of it with that age demographic, who wouldn't just typically think about, hey, let me seek out these institutions to see if my health is where it needs to be mentally and physically? So.
Great question. Because you're right, that's the perfect age group, right, that does not want to engage in healthcare, normally speaking. I think a few things, and I just want to reiterate that I do not have all the answers for this age group either, or for Black and brown men, right, that are 18 to 25. I do not have the answers for those young people. What I do rely on are our team members, right? So we have a strong community outreach team made up of quite a few Black and brown men, right, who specifically go to events, who specifically now have Saturday discussions on mental health for young Black men, mental health for Black men. And I think the other way that we start to do this, and I think we all have a footprint, is in school, right? Our footprints are different in schools maybe, but we are all engaged in work in schools. And I think that's one of the first places that we start. Whether or not, you're getting to the pediatrician, hopefully we're doing some screenings, hearing and vision, and we're talking about mental health, and we're doing some primary medical care in your school, or maybe with a mobile unit that goes to your school. So I think those things are important.
And I think it's important that we push advocates, and those advocates are the community yourself, right? So take your cousin who doesn't think healthcare is important to the doctor, and push that message in. And as my colleague here said, that it's important we build this in families, because it takes a village and it takes a family to really push healthcare. And we all want to see it in the preventative stage and not the reactive stage. It's easier to treat pre-diabetes and diabetes, right? And so when we think about that, it starts from young children being, I want to say, groomed to think as health as second nature, versus when they're in adulthood now having to work life issues around that.
And so when you start talking about behavioral health, specifically behavioral health, because I would be remiss if I didn't say that, gun and youth violence is a public health emergency. Yes, it's something that needs immediate attention. And so what we have to do, I remember my pastor saying you have to catch the fish first, right? So what that means is that when your loved one comes into our center, we have to be sure that we ask the questions. Hey, you have a young man that's interested, what's wrong with them? Or ask about them, and they will tell us what their need is. And I'm not putting anybody on blast, but somebody came to me today with a need. And thank God I was fortunate enough to be able to give them some direction and hopefully help them through that plight. And so all of us take that same stance. I know that we do at People's Health Center, and I know that my colleagues do as well. We have to do that. Our behavioral health arm, the Amanda Luckett Murphy Hopewell Center, we have residential homes that people that are unhoused and adolescents that are going through some changes. It's not an inpatient facility, it's an outpatient, and we teach them how to be more adaptable. And we have CSS, all of us have CSS folks in these spaces to provide them the assessments and the care that they need real time. That's right. 365 days a year.
Sorry, break down CSS.
Let's go.
For us. What CSS means?
Community service, community. Thank you. Say that again. Yes, thank you so much.
Okay.
So in a sense, what that means is it means something different to everybody. A sense, what that means is they can actually assess people when they come in, and then they can give them the support necessary. A lot of them have community health backgrounds, and they have some advanced degrees in a lot of cases. So they're in our residential homes within the community. So check this out, though. And we're talking about financial literacy and everything, right? How do we give back? We give back because we rent homes from people who have spaces to rent. So we give them monies and dollars to help them financially, but we're also fill the void by giving our folks a place to stay and the support that they need. Young men, we have houses dedicated to young men. Young men, we have houses dedicated to young men where they get the support around the clock. Yeah, that's it. Nobody knows. Nobody knows. And that's why I appreciate the Hood so much for bringing this to the forefront so we can talk about us being a safety net. This is what we do.
And why I said it's not just us. Now you got to take that information back and bring someone along, right? So as we perpetuate those messages, more of our communities know what's out there.
You have to share. Wow, 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 wow. All right now, you got to get on the Hood Talk podcast and share this video. And you got to tell your friends to follow the Hood Talks podcast because you just came to one of the lit events and it was fun and it was free and you got a drink and you learned about the housing for young black men. All right. All right now.
Hey. So my name is Marissa Brooks, and so my question is, when we think about holistic care, that biopsychosocial spiritual piece of it, are we making sure that we're communicating with one another? I'm talking about the multiple disciplines within the medical setting. Are we making sure that we're communicating with one another on clients? Because I know that this is just me personally. I don't feel like my physician and CHW and this person and that person is communicate with one another in order to meet my needs.
Well, I can start at that. I mean, you haven't heard of it, I'm sure, but they have what they call behavioral health integration. So like I was saying earlier, it's not that you go to see a different person with a different specialty who is 10 miles away and 6 weeks away. We have the one shop stopping. We're shopping. We're talking about these persons available, and this is part of primary care. I'm sure all of our groups have that. You need a behaviorist, you need a social worker. They're part of the main team. It's not a specialist that you have to work on weeks away. These persons are available right then and there, the same day you come in because your back hurt. You can be talking about how you're having trouble keeping the lights on, or trying to find that ride that we heard about, or maybe you're grieving because of the gunshots nearby, and all kinds of life situations. We have, all of us, I'm sure, have people that will be able to come in and work with each one of the persons on these issues, help them through that, help them to find ways to deal with what can't be done, help us to find ways to help you so that you don't have to deal with what can be changed. And that's a basic premise, I'm sure, for all of us, that these services are available right now, right here.
But that holding each other accountable, sharing information about the crying our family or whatever, because, and what I'm speaking on is that there's a lot of times where people just don't progress something, but that information is not necessarily being shared amongst the team.
So we meet regularly and share.
Yeah.
We all have teams and groups. We get together, we discuss issues, cases. Something may have been unusual or challenging to one of us. We bring that to our monthly meeting and discuss that. And we can sit there and our group can put more heads together, come up with additional ideas. You're talking about shared experiences of all of our group as opposed to just one individual. We all have quality teams. They are running around looking, seeing what we're doing. Are we attending to benchmarks? Are we getting things done that need to be done? Are there ways to help do things better? We have teams that help not only hold us accountable, they help us to see what we're doing. They help us to look at ways that things can be done better. And again, it's a shared mind experience. It's not just one doctor for the whole group, isolated from the rest of the world.
And I also want to just speak to your point that we are not perfect at this. We have a lot of opportunity for warm handoffs. So like when I will directly bring in the behavioral health consultant, or I will directly bring in a community health worker, right? To kind of work on other issues that may not be my area of expertise, right? And that those supports are needed to be well and healthy and thrive as well. If you've ever looked at an electronic medical record, all of those records are in there. Sometimes it could take me 3 hours to read through all of those records. And will I have done that each and every time I see somebody? No. So I will say, to your point, right? We have a lot of information in there. Sometimes it is very hard to glean all of the important things, or quite frankly, what's most important to you, right? At the exact moment. So, I mean, what I'll often do is just ask what's most important, or what am I missing, right? Because then maybe I can go find it. But it's not always direct or the easiest thing to coordinate. And so I don't think you're alone in that experience in healthcare in general.
And patients or clients, they're layers, right? So if you trust us, then you're more apt to give us the information that we can help to make informed decisions. And Melissa was talking about the electronic health record, which really guides our practice, right? So on the internal medicine side or the primary care side, if you're dealing with a patient who has a behavioral health diagnosis, so what we were faced with at one time was on the primary care side, they couldn't see the labs or the medication. Mm-hmm. So the patient would get more labs when it came to their primary care provider. just because of that barrier. So we have since then been able to take an approach to take that barrier down. And because behavioral health is a little different, right? People have to opt in into that and opt out. And we want to respect their privacy and their rights. So we make sure that we're sharing the information with their best interests at heart and that they condone it. The other piece is that we strive to have an integrated holistic healthcare model. And to Melissa's point, we're not perfect. We're not, but we're nimble enough and have the flexibility to be able to pivot. Big systems don't always have that. We do have that.
And I was just going to add that sometimes there's regulations that we can't share some of that information. So even though you're like, well, it's in your system, right? Sometimes regulations prevent us from sharing certain details that you think everyone may know that we can't share by law.
Yeah.
I know you ain't acting funny. You gonna call me over here? You better get this mic.
Earlier, hi everyone, my name is Will Bogan III. Earlier, you all mentioned when she gave the example of being a mom of two and not showing up for our doctor's visit, it was mentioned to ask questions, or the more you all know, you all could assist. Do you all do assessments that address the social determinants of health on the initial intake of patients to kind of gauge where they're at in their care in general and in the PCMH model?
So yes, we all do needs assessments. We all have heat maps that show us what are the prevalent disease processes in certain areas and what we need to do to be able to meet the needs of those communities. So yes, and just to clarify, if you have a problem meeting your appointment, it's not the layers, just let us know, right? Just call us and let us know. So the tendency is not to do that, right? Because there's some embarrassment that's associated with it. And we have to be conscious and cognitive of that. And so what we do, we have providers, when their patients don't show up, they call them. And then we switch it, because we're nimble and flexible, to give them a telephone visit and or a telehealth visit. But they get seen. And if it's medications that they need and we can do that through, we provide that service. So again, flexibility and being nimble enough to pivot and provide that. And yes, we do needs assessment. Did I answer your question, sir? Okay.
Child, we got one more question, and then I have one last question, or more of like, how can people get in touch? But I'm going to let her ask her question, and then people who are tuning in from the Hood Talks podcast, this is why you should be here. Because we're going to get the party started after this. But one last question, and then the live we are going to end.
Hello, my name is Christine, and I'm not from St. Louis, so I am actually looking for a great healthcare provider. Do you all have like specialists like rheumatologists, cardiologists? Because that's what I'm looking for. When I first got here, it was very disappointing. So like every time I need to go to the doctor, I go all the way back to Milwaukee, Wisconsin, because that's how bad it was. And it's like, I shouldn't have to go all the way back home, to my old home. I'm trying to make this, I love St. Louis. So like, I want to make, here my home. I want to come here for, just my health, because that's just too much, because I have a lot of things going on. I have lupus. So I'm just trying to manage that, and I need to see which provider or which place I can go.
So generally speaking, our specialty is primary care, right? So you're not going to, generally speaking, find a rheumatologist or maybe a cardiologist, but maybe a pulmonologist here or there, but you won't find that at the community health center. What I would say is, especially if you have a trusting relationship with your rheumatologist, I hope you can find good specialty care here. I would really want you to tap into any of us for primary care, okay? And then the other thing we can always help coordinate is, say you love your rheumatologist and you're doing telehealth, right, at home. We can sometimes do via primary care then the labs that you might need if we know what those are, or helping you fill prescriptions, or they might be able to send your prescriptions, to a local pharmacy, and we can help you navigate some of that. So even if you can't get to a specialist you just love in the next 6 months, I still think there's benefits of primary care. And then I think there's benefits in maybe coordinating that in a telehealth way and then what you might need at home.
And shout out to the Integrated Health Network. Again, they have a hub that all of us are around the table. So when you come to one of us, we have the capacity and the capability of referring you out. All of us have friends at those health system organizations that we can give a call to just to get the process started. And then your primary care comes back to us and we manage that collaboratively, if that makes sense. No, you should not have to go all the way back to get your care. We got you here.
And so for that, I would say definitely tap into the tables. Again, Medicaid re-enrollment is up at the top there. So if you guys have any questions, if you know somebody that need access, reach out and connect with them so we can get people what insurance that they need, because shout out to Medicaid expansion. It is out there. We just have to tap in. And that's one of the things that I'm big on for us as Black people. There are so many resources out here, y'all, that we just need to tap into them and hold them accountable to give us quality care. All right. So my question, as she kind of hit on, what if I'm like, okay, I'm trying to come tap into some care. Where do I go? Give me some spaces. Who do I contact? Where's the websites? How do I get into this? I know y'all just said come, but just, give us some more details on how we can come and show up in the space one by one. Again, tell us who you are, and maybe even if you want, how people can contact you if they have any questions, comments, or anything as that well.
Visit us on www.familycarehealthcentersstl.org. Also, our table is in that corner there. You got Larissia there that could set you up. And then also just come to one of our health center locations or call us, and y'all would kill me because I don't know the number off the top of my head. But there she goes.
4-8.
We made it even easy.
834-CARE. That's what it was. 834-CARE.
All right. Affinia Healthcare, you can stop by any of our locations. They're on our website, which is affiniahealthcare.org, or our main number is 314-814-8700. Also on all the social media platforms. So if you message us there, someone's always checking and can get back with you as well. And if I'm forgetting anything, the other Affinia folks here that know all the things can help you out, right?
Betty Jean Kerr People's Health Center, located at 5701 Delmar. We also have offices in West Florissant and Florissant, Lindo Boulevard, South Broadway. Our number, 314-367-7848. My email address, rgriffin@phcenters.com. We can also be reached at www.phcenters.com. People's Health Family of Corporations. We got a lot of websites up there, but also our career opportunities are there and all of the services and the areas that we provide. Again, rgriffin@phcenters.com. I will respond.
Thank you. So again, she's looking at me. I'm looking back at her, our director of operations. So I don't have our website handy. We do have a website. We have our general number, 367-5820, that can access all of our telephone needs, but it includes a direct appointment line that you can dial into, as well as an operator to help you to navigate any systems. I'm pulling out my phone because I don't have it memorized. We got you.
Don't worry. Hold on.
We have a telephone number that's dedicated straight to appointments also.
Our website is www.carestlhealth.org. You can also call that main number 314-367-5820 and press 0, and you will get one of our patient access representatives.
All right, y'all. We're going to also drop that information in the comments so y'all can have it. Again, I'm going to ask y'all, if anything else, share this live, share this information, and make sure you tap into the Hood Talks podcast, because what we're doing is bringing you all of the resources out here in the STL streets. All right, y'all. And on that note, this is your girl, Vanna, and we are out.
Shout out to my family. Shout out to my family.
Don't forget it, DJ Sweet Tea is on the 1-2, so we finna party. We got drinks. We got my tickets, so definitely don't leave. Get up, get dancing, and let's go.